Hi, I'm Ashley Posey.
I'm Natalie Ravlin.
And I'm Marissa Aiken.
And we chose Kissing Jessica Stein for our movie. Jessica Stein is feeling the pressure from her mom to settle down and marry the one person that she's meant to be with, and her brother has an upcoming wedding, so it's beginning to cause her anxiety, and her own reservations are waiting until she finds the one. This all hinders her from having a successful dating life and are factors that contribute to her social anxiety.
So we decided to diagnose her with an anxiety disorder, specifically social phobia. People with this kind of anxiety, it's a very crippling type of anxiety to the point where they're unable to interact with people in their normal day-to-day activities. They also experience an overwhelming feeling of self-consciousness and worry. They avoid social interactions and situations for fear of being scrutinized. And they're very afraid of these situations because they think they're going to do something embarrassing or something to call attention to themselves. The reason we believe she has social phobia is because she exhibits a fear of being judged. People with anxiety are often afraid that their peers and others around them in social settings will judge them for doing something embarrassing. And Jessica shows this because she very often gets nervous and skittish around friends and family whenever they ask her about her love life, because she's dating Helen and she's afraid that they'll judge her for dating a woman and not a man like they always thought she would. Another symptom that Jessica exhibits is that her anxiety persists for more than 6 months, and you can see this in the movie from the time she sees the ad in the newspaper for the woman seeking another woman until the end of her and Helen's relationship. There are frequently slides that show up saying 3 months later, and this happens, over a span of around 9 months. And Jessica's anxiety persists for all those 9 months. So it's definitely a valid symptom. So, and then the missing symptom is her fear or anxiety is out of proportion. We would say that her anxiety is very normal, especially because the stigma around being a lesbian, especially for the time period that this movie was in, which was the early 2000s, it was still a new thing, and it was still something that was out of the norm. And so it's very reasonable that she would have anxiety about telling other people about her relationship with Helen.
Okay, for treatment, we chose therapy and medication. The first treatment plan is cognitive behavioral therapy, which would teach Jessica skills to manage her anxiety. And the long-term outcome would allow her to manage her anxiety better and feel more confident in social interactions, like her dates. And overall, this treatment is appropriate because it would teach Jessica skills on how to manage the stress she feels going on dates and having social interactions with others. The second treatment plan is medication, which could be any anxiety medication prescribed by a psychiatrist, just to help keep her stress level at a manageable level. And it's appropriate because it would inhibit Jessica's anxiety from becoming overwhelming. The last treatment plan is exposure therapy, which exposes the patient to their anxiety as a way to overcome it. And overall, it would reduce Jessica's anxiety by helping her confront her issues in a more controlled environment, so that when she's actually put in a real life situation that brings her stress, she would be better equipped to control her anxiety. So the ethics surrounding these treatment plans is that medication to treat anxiety disorders can have harmful side effects, and exposure therapy can actually be counterproductive as it can cause panic attacks and increases anxiety.
The portrayal in the movie is that Jessica's social anxiety is portrayed accurately. She displays a lot of the signs of social anxiety, as mentioned before, as well as panic attacks in the middle of the film, caused by her being lesbian. And her anxiety is not over dramatic like what usually happens in the movies and TV shows, but rather is real and raw and similar to what people who have anxiety experience. And it being over dramatized in in normal TV shows would be shameful and bad. And this influences our thinking of the disorders, as we tend to think of psychological disorders and mental health as issues we need to hide. They're shameful secrets that need to be kept and never spoken about. We see people in films being made fun of for their psychological disorders, and we advocate that with real life.